2, 3.
Congratulations.
Thank you. Thank you.
Plus the mayor's office, plus the city council.
Okay, first of all, I want to welcome everybody to Brown Health, formerly St. Anne's Hospital. It's a great day for the city of Fall River. We're getting new strength into a great South End institution, and it's very, very important. They got a great team here, and they do a great job. And one of the key people that helped to put this whole thing together is down here today to see firsthand what's going on in this hospital. She's a very, very important factor in all the progress going on in the city of Fall River. And she took a keen interest in St. Anne's to make sure this hospital was stabilized, get stronger, and move forward. And I want to introduce my very, very good friend, Governor Maura Healey.
Oh, thanks, Mayor. Yeah. Thanks so much, Mayor. It's great to be back in Fall River. Great to be here today at St. Anne's in particular, and great to be here to celebrate something really, really special. I'm delighted to be here with Mayor Coogan, who's done great things for the city and continues to do great things. I'm really happy to also see Chair Mike Rodricks, who we work with on a lot, Rep. Carol Fiola, and Representative Paul Schmid. A lot of work the last couple of weeks, especially economic development, climate bill, all sorts of good things coming to my desk for signature, and I'm grateful to our legislative partners for all of their support. I'm also very happy to be here today with Brown University Health President and CEO, John Fernandez, St. Anne's Interim President and Chief Nursing Officer, Carol Billington. And I just want to thank Carol in particular, who led us through a tour just now throughout the hospital. And it was a great chance for me to see up close and personal the wonderful and incredible staff and team here at St. Anne's. I'm also delighted to be joined by Tim Foley, Executive President of 1199 SEIU. Worked very closely with SEIU and M&A throughout this whole Stewart ordeal. And the stars of our administration, our great Secretary of Health and Human Services, Kate Walsh, and our Commissioner of the Department of Public Health, Dr. Robbie Goldstein. We started the year with bad news. We got news that Stewart was going out of business and going bankrupt, and that meant serious issues for communities around the Commonwealth of Massachusetts. And as governor, I took it as my responsibility, and our administration took it as their responsibility, to make sure that we were doing everything that we could to save jobs, to protect patients, and protect the stability of the healthcare market. And we got to working with so many partners, and I'm really proud of what we were able to accomplish together. We're America's healthcare leader. Massachusetts is number one in healthcare, number one in education, number one in innovation. We were just ranked the best state to have a baby, to raise a family, to work if you're a woman, and we're America's leader when it comes to actual healthcare coverage. Those are great things, and that happens because of the work of people like those in the room today. We lead for a reason, and it is the dedication and the talent that I just saw on the floors that I was able to walk through this afternoon. It's a collective commitment shared to ensuring access to affordable health care, not as a privilege, but as a right in our state, and a right that we take seriously. Our administration does, our legislature does, and our providers and our employees and workforce do as well. And drawing on all of those strengths, I'm proud that in Massachusetts we were able to do something that no other state was able to do. There were Stewart facilities in states around the country, but only in Massachusetts were we able to do what we did, which was to save hospitals, to protect jobs, and to protect the stability of a healthcare market and access to critically needed care. That includes 1,500 jobs right here at St. Anne's. And in addition to saving 13,000 jobs, we also did something important, and got a bad, unethical operator out of Massachusetts once and for all. Now, this result was by no means predetermined. It took an incredible amount of hard work and perseverance. It took the expertise and dedication of the teams at the Department of Public Health, the incident command structure. It took the passionate advocacy of local and state officials and legislators. It took the determination of our workforce, including 1199 SEIU and the Massachusetts Nurses Association workers, represented by those unions, and workers just generally who stepped forward to talk about the impact of all of this. And it took the support of our hospitals, our healthcare plans, and our community healthcare centers. And ultimately, it's because in this instance, we have a wonderful and reputable provider like Brown University Health, who's stepping up to ensure a quality of care and access to care moving forward. And I am so grateful to John and his team and to Carol for all the work that was done to make that happen and all the great work that's going to happen in the weeks and months ahead. We also established working groups, as you know, to revitalize healthcare access in communities served by Neshoba Valley and Kearney Hospital. But I want to thank everybody who we've worked with and continue to work with. And in a time when our country is divided and facing any number of challenges, this was a crisis in Massachusetts. But we showed what's possible when we work together as a team, when we work in partnership for a greater good. Everybody draws on their strength, right? And everybody is willing to work together. And we pulled something off that's pretty special. So I take that as a lesson and as an affirmation about what is possible. And again, I want to thank the nurses, the doctors, the team, the staff at St. Anne's, and across our state who make us the very best state for healthcare in this country. And that's not to say that we don't have work to do. As governor, I am focused on lowering costs, on creating more housing for residents so we can drive down housing costs, and yes, working on making healthcare more affordable. These are all things to work on, including addressing some of the disparities that we see in healthcare when it comes to zip code and race, ethnicity, all sorts of things. But with all that said, it is important to take a moment and appreciate what is so powerful and so good here in our state, and know that it comes about because we have tremendous expertise, tremendous talent, and people who are willing to work for the greater good. And as governor, I am grateful. And in gratitude, I now want to bring forward a friend, a colleague who I've come to know from other parts of the state, but I'm super excited that he is bringing his talents and compassion and passion and expertise, a real team player and a great leader for the South Coast, and this is John Fernandez.
So, on behalf of St. Anne's Hospital, Governor, welcome. Please come back and hear about all the things we're going to do in the future, which are going to be great. I wanted to say a few special welcomes. The governor covered almost everybody I had on my list, but I thought it would be important to recognize Secretary Walsh, who I've had the pleasure of working with, and her whole team. It took a village to make this come true, and especially one of her colleagues, Chris Harding, who I know is not here, Commissioner Goldstein. I think we have our senators, we have our whole delegation here, and Tim Foley was also really helpful all throughout the process of making this actually happen. You know, I wanted to reflect back to last week. I was at the Health Policy Commission, and I was sitting next to the folks from Boston Medical Center and Lawrence General, who were also part of this effort for the hospitals in Massachusetts. And the one thing that I wanted to make sure people knew, and that they wanted everybody to know, is that it's the people at St. Anne's and at Morton, the staff, the nurses, the doctors, that persevered through a very, very tough time. I cannot even imagine how difficult it was. It's hard enough to deliver care, but it's even harder under the circumstances that they were under. So that commitment to me reminded me, and I know reminded many other people, why they got into healthcare, which is to take care of people. So they deserve the big gratitude here, so thank you all. So I was going to go on. I often tell this joke. Probably some of you have heard it. Is that I'm the son of a preacher and a politician, so I have many pages I could go over here. But I think the governor covered a lot, and there's a lot of work ahead. And we look forward to everybody's support and getting that done. I like to focus on GSD, which is get stuff done, and the people here at St. Anne's have welcomed Brown Health warmly, and we look forward to working with everybody here to have a thriving health system in this area. So now I'm going to turn it over to my friend and Secretary Kay Walsh.
Thanks, John. Thank you, John. I was thinking about what to say here, and I was thinking about, lots of people talk about hospitals as anchor institution, and I said, oh, that's perfect. We're here in a nautical town, and that's to the extent of what I know about anything seafaring. I get seasick on the Staten Island ferry, so, But when I was walking around today, I really was sort of struck by and hearing the stories of the people who were born here, the people whose entire careers have been built here, and I'm so happy that we were a small part of saving this very, very important ship for this community, or I'm now fractured my nautical metaphors. I wanted to say two other things. The first is we would not be here if the people standing behind me and the people we saw on the floors and people who work in clinics and practices all around this region didn't stick with this hospital. There'd be nothing to buy or sell. And so I just cannot thank you enough for your commitment to the patients and to the region, because with that we can build a really bright future. And the last thing I say is, John and I had the opportunity to work together earlier in our careers, and you guys should just buckle up. He's a bundle of energy. He's a lot of ideas. He's the guy when we were working together, the budget would be done, and he'd say, I have an idea. And I'm like, oh no. So this will be a very busy, thriving, exciting part of this community, and I can't wait to come back down and congratulate you all again. Thank you.
Well, we'll introduce because
Man who needs no introduction.
well, that is true. A person who needs no introduction, and somebody who's been an incredible partner in the last 23 months of the work of our administration. I'm ever grateful to Chair Rodrick for not least to wish the Economic Development Bill. That's very exciting for the South Coast and this region, and exciting for the entire state. And thank you once again for your leadership.
Thank you. Thank you, Governor. Good afternoon, everyone. It's really a great honor to be here, and I'm joined by, without doubt, the greatest legislative delegation in the State House, and my colleagues, Representative Carol Fiola, Representative Paul Schmid, Representative Alan Sylvia, who could not be here, this is his legislative district, and we work tirelessly every day to ensure that Fall River gets what it deserves. And our message today is basically thank you to Governor Healy, to her amazing team, Secretary Walsh, Commissioner Goldstein, because if it was not for them, we would not be here today. I can tell you they work tirelessly 24/7, trying to put everything together to ensure that St. Anne's Hospital, now Brown University Health, remains part of the fabric here in Fall River. A hospital that's been part of my immediate and extended family for my entire life, like so many people that are in this room. So thank you, Governor, Secretary Walsh, Commissioner Goldstein. Also, thank you to John Fernandez, an amazing, amazing gentleman. He is bringing with him a world of resources, talent, energy, vitality, that's going to make sure that St. Anne's Hospital, Brown University Health continues to thrive here in the city of Fall River. And we all know that any organization, irregardless if it's healthcare or manufacturing, service industry, is only as good as its employees. So thank you to all of the employees of St. Anne's Hospital for standing strong over the last few months. We know how difficult it has been. And no one knows that more than the next gentleman that I'm going to introduce, who works tirelessly every day to ensure that all of these employees' backs are covered. Someone whom I've worked with for many, many years at the State House that does an amazing job, a very good friend, Tim Foley. Tim?
Thank you, Mr. Chairman. Anything else you'd like to say about me?
Yeah.
Again, thank you for that introduction, and as the chairman said, my name is Tim Foley. I'm the Executive Vice President of 1199 SEIU. We're a healthcare workers union representing over 85,000 home care, nursing home, and hospital workers across the Commonwealth of Massachusetts, and represent over 1,200 workers both at St. Anne's Hospital here and also Morton, which I think is an important story to tell about the Morton Hospital acquisition as well from Brown Health. On behalf of those members that work tirelessly every single day to deliver high-quality community health care, I want to say thank you to the governor, to the secretary, to the commissioner, and to our elected leaders who stand behind us today for all their help and support and advocacy and leadership, and yes, a lot of pushing to get this across the finish line to protect an important community hospital. On April 25th of 2024, 1199 community allies, the mayor, elected officials behind us, had a rally across the street at Kennedy Park calling for a solution to ensure that this community hospital stayed open for the patients and the residents of this community and the surrounding communities. And it's with great pleasure that we're here today to celebrate that call for action and engagement was met by our state leaders here today, but also by Brown University Healthcare by stepping up and ensuring that this hospital continues to provide care for the community that they care most about. So on behalf of our members, I want to say thank you. And clearly, I want to echo a lot of the comments that have been made today about the healthcare workforce that's here with us and who aren't here with us doing their job to take care of patients. As we know, these systems run on those workers and their commitment and sacrifice to ensure that these transactions move forward to maintain access to care should be celebrated by all of us. And I just want to give a good, warm thank you to the healthcare workers that did all the work that they did to get us here today. And it's with great pleasure that I invite some of those workers here to the podium to share their stories about the care that they deliver every single day at this hospital and hospitals surrounding communities. So Daniela Ferreira, Joe Peterson, and Aaron Geary, come to the podium. Thank you.
Good evening, everyone. Thank you for coming. Thank you for having us here. I am very grateful for being to come up to this podium and tell you just how grateful we are for Brown Health to have taken us over, to be giving us this chance to push forward through all of the troubling times that we've had since COVID. That's taken a lot for the community to push through. I am here with everyone here. And it was a long struggle, and our community felt it really strongly. And as you can tell, the system kind of went down a little bit. But with Brown being here and giving us the chance, I'm so happy that we are going to be bigger and better than ever. I am grateful that I stand here before you as a strong CNA that has been here for 12 long years and am a part of this community every day. And I am so happy to see where Brown is going to bring us and bring the community to a stronger stand with healthcare and bring us to such an amazing place. And thank you.
Thank you.
Good evening. My name is Joe Peterson. I'm a health unit coordinator on St. Catherine's unit. I haven't been with the hospital very long, but when I first brought on, I noticed a culture of professionalism, accountability, and charity working here. And it's such a joy to be part of this culture, to be working in healthcare. And I am excited to see where Brown will lead us and just to bring this culture with them also. Everyone in this room is accountable to the person standing next to them. We're accountable to our patients at this community hospital, and it just keeps going up from there all the way to the governor. And if we can keep this in mind, I know that St. Anne's Hospital will continue to grow, and it will grow into something beautiful. Thank you.
Hello, good afternoon, everyone. My name is Erin. I've been a nurse here at St. Anne's for 27 years. I know, shocking, I look so young, but no. But really, I started here as an oncology nurse. I now work on a general med-surg unit, and I am a proud employee of St. Anne's Hospital. We have been through many changes and challenges in the last few years, probably starting with COVID and more recently with everything with Stewart. However, I will say that St. Anne's is a very unique place to work. I was a little surprised to do this today, but I was advised to speak from my heart, and that I will do, because St. Anne's has a lot of heart. We are a family. And we have wonderfully dedicated employees here to take care of our community, our patients, our family, each other as well, if I may say, because without that, I don't think many of us would still be here. I am so grateful for everyone to have helped us get to this point. Our leaders here at St. Anne's Hospital are phenomenal. And I look forward to what Brown Health is going to bring to us. It's very exciting. And yes, I look forward to flipping into a new chapter and seeing what's coming our way. Thank you.
I forgot one thing. I've worked in hospitals since 1979 in 3 states, probably longer than I care or should admit. I have never seen a cleaner hospital. I got to say, congratulations to the team. Don't mess it up.
Thanks, Secretary, and thank you to everybody here, and especially to Danielle and Joe and Aaron for those closing remarks. We're happy to take any questions on topic.
Governor and John, now that the ownership has been transferred for a number of weeks now at the Stewart hospitals, I'm curious from both of you, did you find the hospitals once the ownership transitioned in worse shape than you expected, better shape, about what you expected, now that Stewart's out and the new operators are in?
Well, I'm going to let Secretary Walsh speak to that, and certainly to John, but I just want to reiterate how excited I am about this transformation, about this transition, about how optimistic it leaves me when I think about the work that we can do together. And that's work, by the way, that is regional. We're talking about healthcare right now down on the beautiful South Coast. And, I think about Rhode Island, the relationship between Rhode Island and Massachusetts. That's so important. We have a wonderful relationship happening with clean energy. I celebrated with legislators and union members from Rhode Island this morning on what we're going to do together and win. So, while we're different states here in New England, we all, generally speaking, root for the same sports teams, right? And we all, know what it means to work together, and I'm really, really excited about that.
Great, thank you. Yes, we do root for the same teams, even though I grew up in Philadelphia, but we won't go into that. To answer your question, I would say we found it as we thought, but the really pleasant surprise is the people were better than we thought. And that was already here, and we went to here. It's been absolutely incredible to watch the hard work led by Carol and the team and the physicians and nurses. It's been like, how can we fix the next thing? And that's to me was, I don't want to say it was a surprise, but it sure was great to have everybody sort of lean. And we've only been at this for 6 weeks or so lots to do. And with lots to do, we needed all the help we could get. So I don't know if, Kate, you want to add to that?
Maybe you can speak to the finances.
I think that I have great faith in John. Yeah. Look, I mean, we don't know what the future's going to hold, but I think the commitment to people, when Commissioner Goldstein and I were kind of faced with this challenge, our first step was, okay, what can we keep open? How can we make sure that people get the care they need? And how can we support that? So the finances are, we put the buying power of the state of Massachusetts behind the hospitals that we knew needed to be in those communities, and we created regional response. In this region, there are great hospitals. You guys are really lucky, and we are, supportive of helping them grow and care for people. And I think there are some surprises, and we will help the acquirers weather these capital challenges. I think that, Carol said it best. Kate, you saw the best floors. So there are some that need additional work. Hopefully there'll be places we'll need to expand. We have an aging population. We have young people who want to grow and raise families here and revitalize the city. This hospital's a big part of that. And I'm just really, having worked with John in other settings, you guys will be really busy before you know it. I'm just telling you. You heard it here from me first.
Governor, now that you've gone through this whole year getting the 6 hospitals under new management, but also 2 hospitals closed, how would you assess the overall health of the hospital system in Massachusetts right now?
Well, I think that we know across this country that healthcare is challenging right now. There are serious issues when it comes to workforce across this country. I testified last week, you were there at the cost trends hearing. You know, I don't know a family out there that wishes they couldn't get appointments sooner for primary care, right, for behavioral health. That's not just a Massachusetts phenomena. That's happening around the country. We also know here and around the country there are disparities that exist far too long along lines of poverty and income inequality, race. I look at Massachusetts as a microcosm. We have rural communities, right? So you know this, Rob. There are challenges in healthcare, which is also why I think this is a time for Massachusetts leadership. I'm proud of the fact that we're the first state in the country to have universal health care. Long before the ACA, we made that happen here in Massachusetts and changed lives as a result. We are the state with the highest rate of coverage for people in terms of insurance, and we lead in healthcare and life sciences and innovation. I think this year, you know, I just want to go back both with gratitude and with a sense of pride for what we were able to do in terms of saving 6 out of 8 Stewart hospitals, 13,000 jobs. That's important. We also, as an administration, Secretary Walsh will speak to this, we've done things like increase the number of community health care settings and services, and that's been really impactful. We've done a lot with community behavioral health. So a lot of good work, Rob, has happened. There's a lot more to do. The legislature, again, I'm grateful, recently sent me a wonderful bill I signed on maternal health, making sure that women are getting access to the kinds of care that they need throughout the course of a pregnancy, making sure that they have screenings covered for postpartum depression and the like. So important stuff, that's for sure. And, you know, having been Attorney General, having endured years of Ralph DeLatorre and Stewart's antics, having had to sue him to try to get him to come clean with financials, it's a huge accomplishment for this state that Ralph DeLatorre is probably under indictment and out of business, and that we've got great operators who are here to match and befitting of the work ethic and the compassion and the care that our healthcare workforce brings every day. That's a good thing.
No, I've been in politics long enough to know what the governor said. No, but I would say that, you know, we have a lot to work on, but we have an incredibly strong base to build from. And I think I'll just call out one point that the governor made. You know, EHS and our teams get a lot of credit for kind of architecting this deal. We could not have done that without the colleagues in the Mass Hospital Association, Mass Association for Health Plan, as we were worried about access, particularly in some of the hardest hit Stewart communities. We created, you know, unfettered access to urgent care. That meant insurance companies foregoing copays that they could collect. We did a lot of things that were very sort of tactical, behind the scenes, kind of wonky. People like me and Robbie care about them, but aren't really great sound bites. But it preserved access and capacity as we were transitioning these hospitals. So I think we have to keep doing that work together, and we can't, you know, the state can't solve these problems. It needs to be a partnership.
Where does the debt currently stand that Stewart Health left? Is Brown Health covering that, or are you all working with the state to kind of clear all that up?
Where's the sure?
Yeah.
Step up to the mic.
Yeah, this is when I said at a previous hearing that I was taking bankruptcy for dummies and got in a lot of trouble. But the one good thing about bankruptcy is the debt goes away. So these hospitals come into Brown Health or into Lawrence General unencumbered by previous debts, which is a blank sheet. But they also don't come with any operating capital. So Brown has to make investments in keeping the place running until the services that they're providing right now today, until they get paid for. So that's about probably 90 days of working capital that Brown and Brown Health is providing to keep these hospitals open, and we are enormously grateful for them stepping up.
Governor, I'm curious if this at one time was a for-profit hospital, it is now a not-for-profit. from what I understand, this is going to cost the city of Fall River a seven-figure sum. Now, is there a chance that what happened in Somerset with Reggie dollars, when the power plants closed, could that same idea work here?
Well, you got to help me, you got to walk that through with me. Maybe it's late in the day, but you're going to, I'll tell you what. I think it's...
Short answer is no.
The short answer is, you want to just answer this?
No.
You can speak to Reggie, too.
No, I mean, Mr. Mayor, I mean, you've known that we were, I mean, I think of it as more of the not-for-profit status is really important to the economic underpinnings of St. Anne's. It allows for philanthropy. It allows to participate in federal programs like the 340B program, which helps people get access to medicines at the same cost that the federal government acquires them. And it keeps this vibrant organization open and thriving, which I think will help the tax base of this great city. But nobody is going to be writing a check to the city of Fall River like Stewart allegedly did until they stopped. Is that okay?
Yeah, that's fine.
Okay.
I will say that in my conversations with John Fernandez, he understands the financial burden being placed on the city of Fall River, and we're working together to look at arrangements that can benefit the city long-term and benefit Brown Health in Fall River. This is a great partnership, and we'll do everything we can to strengthen it. I guarantee you that. Thank you.
That's great, thank you. And in broad strokes, just a public service announcement, make sure you seek care. I know there's been an uptick in utilization, people coming here, I think in part because there's a sense of, now we've got, the ship has been steered. And so it's just to say, as we face the winter and cold and flu season and everything else, this is a place with wonderful providers who are ready to provide wonderful care. Make sure you get your vaccines, right? And as you can see, I did my job as governor and got the best team around me, right? People like Kate Walsh. And that's why no matter what comes with the next administration at the federal level, I'm confident in Massachusetts we will work together, we will take care of one another, and we will do great things. Thank you.
Great to see you.